those 2 years, we finally found a medication that worked for Brannen and provided him a good quality of life with no symptoms, no side effects. And we enjoyed that for about 6 months when we received a letter from our insurance company letting us know that they would be implementing the step therapy benefit, that's what they called it, which meant that Brannen would have to start over and go through all of those medications and experience all of those side effects again before they would agree to cover the medication that we knew to work for him.
Even though he wanted to prescribe me a much newer infusion treatment, my insurance dictated that I had to try and fail on 2 older treatments before they would pay for the newer one. And my body just got weaker and weaker and deteriorated. And at the end of those 7 months, my only option really was surgery because my colon was just totally black and the disease had totally just taken over. You know, that really could have all been avoided if it weren't for step therapy.
The year went on. I ended up needing 12 inches of my intestines removed due to the stricturing. And when it was removed and measured, the opening that my food was passing through was the size of a straw. So the years of pain and bowel obstructions and poor quality of life in general, I can't say for certain, but I do truly believe that if I had been given that medication that my GI originally wanted me on from the get-go, that I would have had a much better chance at avoiding a major surgery at the age of 25.
I said, well, how do I earn the right to be on that medication? And he said, well, how many surgeries have you had? And I said, well, the one we just did 5 months ago was my 6th. And he went, oh, okay, yeah, you've probably earned the right to use that medication.
I deal with issues related to step therapy nearly every day. That a patient must try and fail a therapy is counter to the practice of medicine. We aim to treat patients with medications we think have the best chance of making them feel better, not because we're waiting for them to get worse.
Patients should not have to be going through the things they do and jumping through hoops just to get things that are going to improve their quality of life.